My name's Fiona Wolfenden and I graduated from the NCA in 1996, which feels like a very long time ago now. Where I now work from is the Albany Street Clinic, and we've had this as a clinic for the last 5 years, and I set this up with my business partner Rachel. And before that we both worked together at a different clinic, and then we decided to take the plunge and get our own lease and our own premises and run this business together. And what our business primarily offers is acupuncture, but we do rent out room space to other practitioners, so we have quite a nice cohort of massage therapists. But our acupuncture mainly focuses in on fertility treatment, with maybe a 70-30 mix of fertility patients and non-fertility patients coming through the clinic for acupuncture. And why fertility seems to be a big part of our business is a good thing that I sometimes ask myself, and it's because it was a natural progression of more patients coming to us. This was in the sort of after the millennium, we noticed an increase in patients coming to us with gynae, stroke, fertility issues, and it evolved from that. Plus my business partner Rachel had the idea of let's make it more formal and call ourselves a fertility clinic. So it was born for those two reasons, the sort of the natural progression and a business entrepreneurial idea. And I think I have to also reflect on why is fertility quite a big part of our patient base. And I think people are now reading up a lot more online and from support groups about acupuncture being a very valid treatment to help them through their fertility journey, whatever point they may be at on that, whether it's preconception or then going on to try and conceive, or going through actual Western medicine fertility treatment, or after, if they get pregnant we can also help, or if they still have to continue on their fertility journey, acupuncture can be very useful for helping them with this. And we see PCOS, we see endometriosis, we see perimenopausal women who are still wanting to conceive, or with premature ovarian failure. We see people with irregular cycles. So we see a whole host of issues that we can then move through into a Chinese medicine diagnosis. We also work as a team, so we share patients quite a lot depending on the patient's time and schedule. And we also have a nutritionalist based here, and we have a fertility massage therapists that we refer often patients depending on their diagnosis and what treatment plan they would be interested in being sort of worked out for them. So that's the unique part of here, is that we work as a team, and I think quite a lot of the time it's easy to be isolated and just work on your own, but we can't cure everything with acupuncture, and it often has to be a team effort, as well as lifestyle medicine being practiced by the patients. So yeah. So to give you an example of one such patient, we had a patient who had been through quite at least 2 IVFs, and she works in a sort of social work environment, and she was very stressed because this was looking like it was going to be her last IVF treatment, and they were self-funding at this point and they couldn't do any more. And she had a low egg reserve, which blood tests had shown up, and so it was a very difficult treatment process for her, and we helped her through that with acupuncture, going through the IVF, and obviously we did a workup before the IVF started to promote the best egg and sperm quality. And she went to see Jill, our massage therapist. She came in for regular acupuncture. She took some of our supplements. We've got a range of supplements that are bioavailable in food state, and that was formulated by our nutritionist with this fertility client group in mind. So she did a really conscious workup for this IVF, but as I said was very stressed, and she had one embryo that was managed to be made through the IVF, which again is quite a low amount, and that was popped back in, and she was very stressed waiting for the results, and it came back as a positive result. And I just happened to think of her because she popped in this morning to have a fertility, not a fertility massage, but a pregnancy massage, and she's now 16 weeks pregnant, and we had a discussion about her guinea pigs of all things, because her and her partner bought guinea pigs as almost surrogate children. So we had a little joke about that. So what was she going to do now with her guinea pigs, now that there's going to be a baby arriving in sort of 5 months' time, or so it was just, that's what came to my mind just now, was this patient. As an acupuncturist, we have, as part of being a member of the British Acupuncture Council, we have a requirement to have continual professional development. So I very actively do that, and I really enjoy continuing my learning process. It's not just a case of doing my my diploma or degree and then that's it. So in fact, it's probably more the issue like what do I not do, because there's so much that interests me. But I do quite a few courses over a year, and I'm now saying to myself I can't do any more because I need to consolidate what I've actually learned. So I did a course on cupping, fire cupping, and I did a course on electroacupuncture. This was just 2 single study days, and I now need to really bring this into practice. And Western medicine, well, it's often learning from patients, because they're often walking textbooks on fertility, so they will tell me about different tests or different clinics. So I write that down and remember to pass this on to patients. So quite often I feel like I am, to a degree, filling in quite a lot of the blanks that patients have here from a Western medicine point of view, and I will be recommending various Western medicine tests that they think about getting of, so for example, there's quite a few patients I might consider would be worth getting the hidden C test, which is menstrual blood testing, which is done by a clinic in Athens, or immune system testing. So basically trying to fill in the gaps that there might be in that individual patient's case from a Western medicine point of view, as well as then obviously taking the notes home and working out their Chinese medicine diagnosis, lifestyle recommendations for that particular case. If I was advising someone about whether they should or shouldn't become an acupuncturist, or if they were thinking about it, I would say, I can only say for myself, it has been a wonderful career choice. I was initially a nurse and moved out from that because Western medicine didn't answer all the questions for me, though obviously it has its specific and wonderful role to play, but it wasn't enough for me in lifestyle medicine terms. So I would think to be an acupuncturist would be that interest or something, embracing what Western medicine doesn't embrace, and an interest in human beings, their health. Lifestyle medicine, I would think, would be quite important, so that you're interested in preventative medicine, though it's harder to obviously research and be sure about how that actually comes through. I would say having a good sense of business is important, so, and also a sense of looking to work as a team is I would say, in my opinion, important, because a patient will often benefit the most from a team approach. So I would have to say that I wouldn't be here today running a successful business where we have at least 10 practitioners in total renting this business space. So I wouldn't be here today unless I'd made that initial voyage to the Northern College of Acupuncture's Open Study Day, which I went to, because there were other colleges I could have picked, but this was the closest to Edinburgh, and there was good journey times, and that was all a consideration for me. And they gave me the gift of traditional Chinese medicine theory, diagnosis, practice within their clinic, which was wonderfully run by a Chinese woman called Dr. I can't remember her name now, but she was brilliant. And so we had lots of practice in a clinic with real patients, and that was the gift from the Northern College of Acupuncture, was giving me that foundation of Chinese medicine, with enough of a foundation for me to become a practitioner, and then from the years since then build on that with study days and my own confidence built up with success of treatments and liaising with other colleagues. So yes, it's been a wonderful journey, and I can't believe I've only got maybe 10 years left before I retire, and I just think, where's that time gone?